Welcome again. My name is Günther Rautz. I'm the director of the Institute for Minority Rights, and I will now introduce our experts. First of all, I start with Marika Djolai. She's head of conflict and security cluster at the ECMI in Flensburg in Germany, the European Center for Minority Issues. She holds a master degree from University of Novi Sad and University College of London, and received her doctoral in development studies, conflict violence in 2016 from the Institute of Development of the University of Sussex. Her research focuses on violence, post-war social interactions and social identities in ethnically diverse societies. And when I give you the floor, we will speak especially about a study which you elaborated with colleagues from the Europe Policy Advisory Group. You are a member of this advisory group since 2015. And now during the Corona, you published this policy brief, I think it was in April, on the Western Balkans in times of the global pandemic. And this will be then my first question. The second expert is an old friend of mine, Ranabir Samaddar, director of the Calcutta research group. His particular research have been on migration and refugee studies, nationalism and post-colonial statehood in South Asia. I know him more than 20 years now, when he was still director of the Peace Studies program, South Asian Forum for Human Rights in Kathmandu. I think you did this job from 1999 to 2003. And we had some projects together. So we organized several programs on human rights issues and minority protection with the German Naumann Foundation. And then we run also a FP7 research project called Eurasia Net on soft law mechanism in Europe and in South Asia. So welcome, Ranabir. And finally, my colleague from Eurac, Andrea Carla, is senior researcher at our institute at Eurac Research since 2014. His main research areas are comparative politics, ethnic politics and conflicts, protection on minorities, migration policy, security studies. He wrote his PhD at the New School for Social Research Department for Politics in New York, and was visiting scholar at the American Political Science Association, Washington, D.C., at the Roskilde University in Denmark, at the Pompeu Fabra University in Barcelona. And he has a lot of publications, especially on old and new minorities and identity issues, publications on societal security in South Tyrol, and very often in comparison with Catalonia and other autonomous regions in Europe. So welcome to our panelists. And I want to start with Ranabir. Ranabir, your institute, the Calcutta Research Group, published 2 books now in Corona. So the first was really a book. It's called Borders of Epidemic, COVID-19 and Migrant Workers in India. And the second book is The Burdens of an Epidemic, which was published only a couple of days ago. And we had a workshop last week where you elaborated very well the situation in India. And I will really only ask you to give you, in the next 8 to 10 minutes, an overview about India, what happens there under COVID, with all the problems before. There was this passport issue before COVID, then the border issue also with China, COVID, and yeah, I think India has, at the moment, it's not really shining India, but more shaking India. So Ranabir, please, the floor is yours.
Yeah. First of all, thanks to Günther and other organizers, also Eurac, for inviting me to this platform. And by now I have probably attended 7 or 8 discussions on the book. So each time I have to reinvent something. And I feel bad also in repeating something that I had, earlier mentioned. So while I was thinking about what to tell or what can be a refreshing angle, partly to myself in the sense that I keep on going back to what we had written and rethinking on them, I was, I latched onto the phrase in the title, or the word in the title of the seminar, security. And in the 7 or 8 discussions, preceding discussions on our book, I had not seen the concept of security, being foregrounded as a central question in this, in the wake of the epidemic. So I thought that I will speak a little on the security question, and then maybe in the question answer session, we can elaborate that. And in the course of discussion on security, perhaps we may also touch on some of the other things. I think one of the, I will go very quickly, 3-4 points, and really bullet points. I can't explain in this time. One of the ways in which security was till date addressed was basically a liberal way, and the liberal notion of security was perched on the idea that it is the responsibility of the state to provide security to the citizens, and the citizens in turn get rights. So there is an exchange between the responsibility to provide security and on the other hand, the rights of the citizen to enjoy the conditions of freedom. And this liberal norm of security was also in a way reinforced by what can be called the liberal way to make war. Whereas, even to conduct war and even to wage war, certain liberal norms were put in place, laws of war, Geneva Conventions, etc., etc. But this kind of balance between the responsibility of the state and the reason of the state exists because the state will give you security. And Charles Tilly, I remember, had said that state is like a brigand. The state is like a tough of the area, the bandit, who provides security to the local people and in return gets taxes and all that. Now, this liberal schema of security is torn asunder by the pandemic. Now, it's not that this was completely astonishing, because the liberal notion of security was not enough. Already thinkers were telling, and they tried to come up with alternative concepts of human security, etc. But again, if you really go into the notion of human security, you can see that the question of public health did not occur fundamentally in the idea of human security. And even though the questions of life, food, environment, all these things came up, but disease really never featured as a central question in the ideas of human security. I think this is where a new situation has come up, where security is now perched on the question of, how do you trade death with life? In other words, the way now neoliberal governments and states all over the world are treating the question of pandemic is, even though they sometimes blurt out that they depend on the notion of herd immunity, but by and large, the strategy is how much we have to sacrifice in order to save people. Now, as you know, Michel Foucault had made a great distinction between the earlier forms of sovereign power. He said the sovereign power had the right to inflict death on people, on subjects. And modern states have the responsibility, their legitimacy comes from the fact that the modern state allows the people to live. But I think this great breadth is now also put into question by the appearance of the pandemic, or one might say by the absence of our historical knowledge, our historical sense of the great marks that pandemics bring to human history, particularly political history, the history of subjects, citizens, etc. And this is very clear, even in our own country, where governments are continuously calculating how many deaths are necessary, well, minimum deaths, so that we can ensure maximum life. Now, this tenuous balance between death and life was never brought so starkly on our face as has been brought by the pandemic. And this is, in a way, you may say that a continuation of, on one hand, neo-Malthusian policies, where the idea is how long can we keep the people at home? How much a labor can be allowed to be unproductive? So the idea that labor has to be productive and otherwise unproductive labor is a waste. And coupled with this, a kind of a social Darwinist policy actually makes the neoliberal orientation to a massive global public health crisis as this one so stark. And this is very clear in the way minorities, which I define as minor groups of society, whether they're people of colored origin or they're migrant workers or they're old people, vulnerable groups of society, they are considered as necessary sacrifices, as if a slice of world population will be chucked off, and then we shall be able to say that, okay, we have been able to save ourselves. Now, in India, I will conclude my remarks that this whole plank on which the state response to a public health disaster is perched is primarily made of two planks. One is the old colonial act, which is called the Plague Act, which is actually, the name was Prevention of Epidemic Diseases Act of 1897, which introduced in a big way the idea of the lockup, the idea of separate hospitals, etc. I can't go into that. And second, the National Disaster Management Act of 2005, which again ensured legally that to manage disasters, you have to centralize all powers in the hands of the state. As a result, what has happened is three consequences. And with this, one, politics has been completely demobilized. Second, the social capacity to mobilize people, whether you think in terms of contact tracing, in terms of helping people to isolate themselves, in terms of protecting the communities, in terms of protecting the vulnerable groups, in terms of understanding that family is often the institution that first of all protects its own old people, children, etc., etc. So there is, so therefore, as I say, that there is a demobilization of politics, there is a demobilization of social capacity to forge an appropriate response. And finally, at the same time, there is also an appearance of a new phenomenon, which I have been arguing for from the first book that Günther had mentioned, Borders of an Epidemic, that there is also the emergence of a new vision what a caring society can be. What do we mean by a society of care? What is biopolitical response from below? What is the desirable society of future? A new organization of power, in emergence of a new type of public power, which can actually coordinate on a dialogic platform the social responses at below in terms of defending human life. Now, that response never trades death with life. The fundamental ethos of that response is, as you can see throughout the world, and massive amount of human stories are coming out, which do indicate the pattern that the principle of solidarity, the principle of care, the principle of caregiving, of which migrant workforce is a big chunk, is something which is today standing in stark contrast with the neoliberal response to the epidemiological crisis, which is broken out at global level, and of course in my country also. Thank you. You have to unmute.
So thank you, Ranabir. We had a workshop last week, and Ranabir quoted Marx saying the question of work is the question of life, and then you paraphrased it to the health question is a question of life. So I think maybe we can come back later to that. And what was also very interesting, the power of local community. So if it comes to health questions, it's maybe in future less the state responsibility, but more the local solidarity. But this is maybe then the question for the discussion. Let's go now to Marika. Let's go back to Europe, and maybe you can introduce your study, which you did with the working group on the Western Balkans in times of the global pandemic. Also, Florian Bieber is working there, and Mark Mesic, old friends of Eurac. So please elaborate a little bit on your study, which you did in the last weeks on the Balkans. Thank you.
Thank you very much, Günther. It's really good to be here and to talk about the security issues, because they have been a big concern, especially for the citizens of the Western Balkans, but also for us, for analysts who work on the Western Balkans. We did this BIEPAC study, as I was saying earlier, when we chatted sometime end of March, beginning of April, so when the pandemic was just unraveling around the world. And it was interesting to revisit it now to see what actually happened in the meantime, and also with the research that I have done in the past 2 months on these issues. So one of the reasons why Western Balkans, which is the 6 countries, is really interesting is that all of the 6 countries, the governments of all of the 6 countries have introduced a state of emergency almost immediately in mid-March. So we have seen a really blatant securitization of the pandemic, not just in narratives, but in the actual behaviors as well. And in all of the countries, you could see heavily armed police, army out in the streets, allegedly protecting citizens, although lots of the questions have been raised by activists and NGOs and independent media. Why do citizens need heavily armed police with automatic rifles to protect them from corona, where actually protection is usually expected to be found somewhere else, like in the health system and in the services. So that is something which actually raised concerns in the sense that, and questions whether the partially or totally authoritarian regimes that we have in all the Western Balkan countries are just using the corona pandemics to actually reinforce their position with an excuse to use the military and to use the police for this purpose. So that was the main assumption. And then, of course, another question is whether during these interventions, minorities are particularly targeted by this security response. So I have looked more deeply into the role of the state in the COVID crisis. And there are a couple of main points that I would like to make here, at least at the start. So state of emergency is introduced in all of the countries, and in some countries it actually lasted until late June, like in Albania. It has just been lifted now. But then interestingly, In Serbia, it was lifted fairly early in May, but only because the president of Serbia, Vučić, decided that he's going to have elections, Serbian national parliamentary and local elections in June, and just abruptly ended the state of emergency. And basically, there was no indication that he or his government cared about the citizens at all and protecting the citizens. We have seen a similar situation in Montenegro and to an extent in North Macedonia. I have tried to further develop and to think about how, you know, how to think about the relationship, the relationship between the state and the citizens in the times of pandemic. And I think one of the issues that was quite clearly came across was the issue of trust between the citizens, just all citizens in the Western Balkan countries and the state, and then of course between some of the vulnerable, more vulnerable groups and the state and the government, both the local governments and the national governments. And I think what we've seen is that this trust, or actually the lack of trust between the state and the citizens, rests broadly on three benchmarks. One is availability of accurate information about the pandemics and about how to be protected from its impact on both group and individual levels. The second benchmark of trust is ability and willingness of the state for direct protection of the citizens, but also of the residents, or of all of those who happen to find themselves in the countries. And here I'm also referring to, for example, to new minorities, to migrants and refugees who just happen to be in the countries, and there is a broad issue and many problems around their rights to access to services, for example, to healthcare, and to protection in general. And then the third benchmark of trust is governments and the state's commitment to long-term economic stability and being prepared to support all the citizens, and especially the vulnerable ones. And what we have seen in the Western Balkans over the past 3 months is that when it comes to accurate information, all of the states and all of the governments have pretty much failed. And the concerns about lack of information or the accurate information have been raised at different instances for Serbia, for Macedonia, for Montenegro, for Bosnia and Herzegovina as well, to the extent that, for example, the OSCE representative on freedom of the media felt compelled to actually issue a statement about fake news in Bosnia and Herzegovina that were circulated, completely uncontrollably across the country and among the population, and creating not only confusion but panic as well. And then we also have seen largely failure across all these countries to protect the citizens. The health system, as Ranabir was saying earlier, public health system has it came up to be in such a poor shape in all of these countries that it really failed to offer the basic protection to the citizens. And we have seen, for example, in Serbia, many gruesome pictures and reports from hospitals that are really in a poor shape, and it felt like we traveled back 70 years in time. You know, and found ourselves stuck in places before modern medicine even appeared. So I would somehow like to wrap up that actually on all of these three benchmarks, and especially I have now mainly focused in my research on these two. You know, the trust, the states in the Western Balkans and the governments managed to undermine the citizen trust even more than it was before the pandemics, and we have just seen further decline in democracy and rise of authoritarian tendencies across the Western Balkans, relating in many problems. And also the fact that the states have so easily resorted to security measures, to the state of emergency, just further eroded this trust further. So I will end here, and then perhaps later I can give a couple of reflections specifically about minorities and whether they were targeted, and what were the relevant issues when it comes to minorities in the Western Balkans.
Thank you, Marika. When I read your policy brief, there was one finding also regarding the European Union. And maybe after I will ask now my colleague Andrea Carla to give his presentation, I come back with a question regarding the EU accession process on the Western Balkans and how this is under the COVID-19 situation now, if there is maybe a special challenge or acceleration because of COVID-19. Andrea, when we prepared this webinar, you told me this is our core business, that you want to focus more on the minority issue. And you see also short and long, middle term consequences of the pandemic. So maybe please give your first statement. Thank you.
Yeah. First of all, good afternoon to everybody. Thanks to Günther and my colleague at the Institute for Minority Rights for organizing this set of webinar. What I'm trying to say, to provide today is some kind of few insights, few analytical lens based on a piece of information I collected these past months, also some report and some comments that scholars are starting to write about COVID-19 and its impact. If we consider the short-term period, so these past months that we have experienced, I think we can make 5 different sets of security-related considerations in general, and more specifically regarding minorities, in addition to something that already Ranabir and Marika already pointed out. The first point is that the response to COVID-19, as already Marika has highlighted, has been a politics of securitization, process through which an issue is considered as essential threat requiring emergency measures. So the virus has been securitized. It is clear, besides what the practice Marika described, also from the rhetoric of war. We saw this a lot in media, in public discourse, speech by politicians. We are at war against our enemies, the virus. What is interesting is not just the virus has been securitized, but also some specific activity, human activities, which is the circulation of persons and social contacts. These are dangerous activities. We should try to refrain from these activities. So this process justified emergency measures, all the restriction of liberal freedom and rights we have experienced with lockdown. And so we are living in a state of exception that is accepted right now. In some countries more than in the others, but more or less is a general dynamic. And of course, the risk of this is always to have authoritarian moves like what happened in Hungary with Viktor Orban. So this is the first set of security-related considerations generally. Now, looking more specifically to minorities, we clearly saw that the pandemic has raised a lot of insecurities affecting some minorities more than others. We know that in an emergency situation, minorities are always at risk of being excluded. Now, the virus theoretically doesn't not discriminate. Everybody can get sick, everybody can die, but we saw clearly that in combination with the existing inequalities, structural discrimination, the virus has discriminated. In addition, the state response in delivering the healthcare and implementing some of the lockdown measures also discriminate because has impact the right of some people more than others. So in particular, some minorities are being disproportionately affected. I say some because we do have to distinguish within the minority galaxy, let's say. The pandemic had hit in particularly most vulnerable groups, what Ranabir was pointing out. We speak about minorities, general concept, but the pandemic hit the most vulnerable groups. If you look at Italy, European countries, these are in particular the Roma population, migrant communities, undocumented migrants, but not only them. Actually, in the past weeks, there have been a couple of reports published by Public Health England, US Center for Disease Control and Prevention, also a statement made by the United Nations High Commissioner for Human Rights. And this report, this statement, they point out that the virus has a higher death rate for some minorities. So in Brazil, people of color are 62% more likely to die. In the United States, African American and Hispanic have a higher or even double death rate. Similarly, in the United Kingdom, blacks, people of Pakistani, Bangladesh people have a higher or even double death rates. And there is people pointing out there are a lot of factors in play here, like the marginalization, discrimination, accessing healthcare. The fact is, members of this group, they tend to live in overcrowded housing, but we still don't know the causal relationship. But we know that death rate is higher. So the pandemic has raised a lot of insecurities for some minorities, health insecurities, economic insecurities, social insecurities. If you look if you look at health issues, in addition to what it is higher death rates, we can see that some health preventive measures were, let's say, more problematic for some groups. For example, the simple rule to stay home is more complicated when people live in slums, in camps, or not to speak if they're homeless. So, and this is the case, for example, of part of the Roma population or undocumented migrants. I remember there was an interview by a Roma woman in Italy complaining that the Italian government was taking care more of dogs because there were all these exceptions to the lockdown for people with dogs, but there were problems with the Roma population living in camps where the hygienic situation is not always great. If you look at economic insecurities, the pandemic, the lockdown has sparked an economic crisis. We know that, but some people are more affected than others during the lockdown. In particular, the situation hits especially people working in the formal economy or domestic workers. This because these people have not only lost their income, but they didn't have access to the social welfare sometimes. And we know some minorities, they are well represented in these economic sectors. If you look at education, that is another sector that was a serious problem because digital education and homeschooling are proved to be clearly to discriminate against children from vulnerable groups. So we are here. I saw a report by a Spanish NGO pointing out that 1/3 of the Roma students could not carry out learning tasks during the lockdown. So another issues affecting minorities is that this is the third point, is that not only the virus has been securitized, but clearly some minorities have been securitized. Indeed, the pandemic has increased fear and has increased the politics of fear. And on the one hand, we saw many populist politicians linking minorities or migrants to the spread of the disease. On the other hand, we saw many governments, some governments looking for scapegoats to justify their failure. Here, Donald Trump, of course, in the United States is a good example with the speaking of the Chinese virus of both these trends. But so we have many episodes of racism and discrimination against people of Chinese origin in the United States, but not only in the United States, also in Europe and in Australia. But it's not just Chinese, there are also concerns for the Iranians. In India, if understood correctly, Muslims were presented as super carriers at one point. In the United States, Trump has blamed Latinos for being vector of the disease. In some European countries, the Roma population has been blamed for spreading the disease. And especially, we saw that the migrants community have been targeted of this process of securitization. And that is because the pandemic has overlapped with just a few years. I mean, what we were talking about before the pandemic is the refugee crisis. And there's also overlap with existing anti-migrant political force, anti-migrant political discourse. And the pandemic in this situation has further legitimized for public health reasons the need to control migration or limit migration, prevent undocumented migration. And this has increased the risk of xenophobia and intolerance. So we have a strengthening of, in some cases, of the state security narrative and the government practice toward the migration. And we have many examples of this. Hungary and Greece no more, but they have suspended the asylum seeker system. In Germany, the far right has linked the spread of the virus to immigration. In the United States, migrants, undocumented migrants, are being returned without due process. And this is interesting because it was done invoking something that was never used before, like a public health status. More recently, Trump has suspended the release of working visas, and before that, green cards. So we have this process of securitization of minorities. So we have insecurity for minorities on one hand, and the process of securitization of minorities on the other hand. And connected to this, I will also say this is the fourth point, is the concept of borders have somehow been securitized, in the sense that who is outside is perceived as a threat, might carry the disease. And borders during the pandemic has been seen a lot, mainly as a protective tool. And they have all the border closure and all the travel restrictions. And this, of course, create problem. People try to cross the border, might even create tension in border areas where often minority lives. And now the last, I will just cut short. The last point is the fifth security-related consideration. We'll say we can look at the pandemic using what Ranabir already mentioned, using the concept of human security. So we can define the pandemic as a human security crisis, because of human security, freedom, summarizing the slogan, freedom from want, freedom from fear, freedom to live in dignity. We can say that the pandemic and the lockdown are somehow deprive some people more than others of these freedoms. So we have a human security crisis, which means we need a human security approach to deal with the pandemic. Not just need to find a vaccine, we need a different type of approach to try to resolve the situation. And I stop here.
Thank you, Andrea. I saw that now we have the first questions from the chat room, and I think also the first one is addressed to everybody, but India is mentioned, and the excessive centralization of powers. And Ranabir finished his first statement on the powers. They are concentrated now at a state level. Last week, also at our workshop, you said there was a question on the federalization of India. And your answer was federalization is not a constitutional question, but is a question of defense. Maybe Ranabir, you can elaborate a little bit more on this powers, state power issue.
Yes, there is the related question of war, because there is something in the idea of the epidemic or pandemic which always invokes the war scenario. And this is not surprising. Think of Thucydides' description of the Peloponnesian War, where he actually sets the whole plague crisis in Athens and the death of Pericles in the context of the Peloponnesian War and why the Athenians were being defeated. Or think of the Justinian plague, one can go on. But the colonial situation. The Chinese president spoke of a people's war. The people have to be mobilized in a way so that all the resources can be marshaled and brought to bear on the ways to control and to deal with the crisis. The Indian Prime Minister actually spoke of the Mahabharata, the epic war, but little did he remember probably at that time that the end of the Mahabharata, both sides are destroyed. Only 5 wise men with their faithful dog go to heaven. So my answer is, as I gave, that a public health crisis through the history has always invoked in the social imaginary and in the political imaginary the way in which societies can fight war. And I do not think that you can take a human rights view in order to say this is not a war. And in that sense, I have also written that I part with the basically anarchist philosophers who would say that state is not required. My own understanding is that you need a new organization of power, you need a new type of public power that will always try to devolve the social capacity and the capacity at each echelons of society, its own resources to come up with strategies to quell with the epidemic. And unless the way in which power has to be reorganized is addressed in our political imaginary, we cannot face and we cannot address the question of the centralization of power, which is inevitable in the context of a war. You cannot have a war, only a guerrilla war, where there is no centralizing force. On the other hand, the moment you say that states are actually fighting the epidemic, if you think of India as a federal system, then states can fight precisely because states are feeling the heat of the whole thing. The flames are directly touching the state governments, and the states have to rely on municipalities, on cantons, on village panchayats, on local self bodies, slums, nurses unions, doctors federations. The state has to continuously talk to them to mobilize the resource and invent new ways. So I think the main question is not so much, that power has been centralized. Of course, powers have been centralized, but the question is, how do you face it? Given the fact that fighting an epidemic is in human history like fighting a war. Therefore, what will be the different kind of thing? And I think Marika raised the question of trust, which is extremely important. That in a people's war, or if you think of Clausewitz, that war is the extension of politics by other means, is the same with any public health crisis also. So I think the question of trust is important because trust precisely brings in the question of the social multiplicity, the plurality of the dialogic levels on which you can face and you can tackle, or you can find out ways of how to combat an epidemic.
Thank you, Ranabir. The question was for all the panelists, so maybe Marika wants to add something. And my question to Marika, when you have in Europe not only the state layer, but also the European Union, maybe you can link this also to the European Union.
I didn't understand the second part of your question. I'm sorry.
From the chat.
Günther, you're mute.
Sorry. I'm not sure. This the question was so the same question to all the panelists, and I would add the question regarding the European Union. So what is the role of the European Union if we speak about trust, for example?
Okay. If I start with your question about the European Union, I think it was really interesting to see how these dynamics with the European Union developed over the past few months. since the crisis started. So on the one hand, we had a situation in March where both Albania and North Macedonia finally got a green light to open the accession talks with the European Union, which is extremely important step given that they waited for 18 months. And also a few days later, North Macedonia joined NATO. So in every sense, this was kind of a big support on the part of the European Union to the governments of Albania and North Macedonia that they're on the right path. And I think given especially with the complications of North Macedonia, that they, that the government struggled to deliver some promises to the citizens, it was, it could have been a first step on reinforcing a positive relationship between the citizens and the government. But then the crisis happened, and what we have seen, and I think perhaps most blatantly in Serbia, is that the relationship with the European Union has been portrayed in an extremely negative way, and that using this example, that the government of Serbia insisted that the real friendship and support was coming from China and not the European Union, and that actually European Union was not or is not a friend of Serbia. And then the European Union, which perhaps initially didn't completely find their footing on how to navigate the support for the Western Balkan countries, but nonetheless, it has sent a lot of aid and help and support throughout these months. But I think it was this initial tumble, and that's what I was talking about the information and fake news and correct news. So this initial stumble was used by the governments of the Western Balkans, especially in Serbia, to portray the European Union as the enemy. And I think the citizens of these countries certainly didn't feel like the European Union was friendly towards them. And this, the way that European Union initially reacted by closing the borders and maybe not supporting the countries completely was, opened a whole array of possibilities for the governments to then demonize the European Union. And I think later interventions have been politicized in many different ways. And then, for example, when the Serbian government decided to run the elections, which were completely rigged, as all analysts agree, and now we have one-party system in Serbia. Some of the first congratulations came from the European Union, from the Commissioner for Enlargement, Verhedi, and from Donald Tusk. So I think, and this led to wide condemnation of the actions of the European Union, and how they see and how they act and how they interact and what they support in terms of politics in the Western Balkans. So And just yesterday, we have a situation where Montenegro will open a new chapter in the accession process, but Serbia will not. Serbia was expected to open chapter 8, but now this has been put on hold. And also what Andrea was talking about, the importance of borders. The European Union has now decided to open the borders only to citizens of Serbia and Montenegro, but not to citizens of the other 4 Western Balkan countries. So to just summarize, there were mixed, the actions and the messages from the European Union have been very mixed throughout the pandemics. And I think certainly, first they gave a floor to the governments, to the authoritarian governments, to misuse these actions, but they also certainly didn't offer a lot of confidence and the sense of, positive or sense of protection to the citizens of the Western Balkans. And in that sense, I don't think they contributed to building the trust, between the states and the citizens.
Thank you, Marika. We have only 7 to 10 minutes left, so I will ask you now a final statement, and maybe we should try to have a positive approach at the end. And I want to ask Andrea, we have, especially in the region, South Tyrol, North Tyrol, Trentino, so the borders were not completely closed. There are some positive examples, and maybe you can elaborate a little bit what was possible, although the borders were formally closed.
Yeah, we have this tendency, also noticed during this webinar, to look to highlight somehow these call it negative consequences and negative impact of the COVID-19 and the pandemic instead, and highlights all these negative things that happen, like minorities securitize, rhetoric of war, a state of exception accepted, and stuff like this, problem of power. But we also have some alternative narrative discourse practice happen during this pandemic. And one is what Günther just mentioned. Yes, we have a lot of border closure and problems at the border, but we have a lot of cases of border cooperation and trans-border cooperation and cooperation between states, international cooperation. Just to mention some, we have, Germany put together the mission wing, which is a mission with which the German Luftwaffe has brought to Germany patients from Bergamo, which one of the city that was most hit by the virus, but also from France, Lithuania, and I think also from Kosovo, if I'm correct. The people from South Tyrol they were brought to Germany to be hospitalized there, and also people from South Tyrol were hospitalized in Germany. And also we have a cooperation between the provincial government of South Tyrol, the Austrian government, and the regional government of Tyrol to buy together. They cooperate to buy medical equipment in the worst period of the pandemic, when it was really hard for states and regions to fund this type of equipment. So we do have also this, let's say, more positive but what have positive things, action that happened during the pandemic. The same is also not just about international cooperation. We saw also, you mentioned the problem for minorities, minority presented as a threat, stuff like this, but we also have some positive action that were taken in favor of some like minorities, some migrants communities, in light of the pandemic. I mean, we read at the beginning, we know that Portugal has granted migrants and asylum seekers temporary resident permit to give them access to the social system. So, and also really interesting, during the pandemic, we reevaluate the values of some migrant communities. First of all, people working in the healthcare system, and then also agricultural workers, because during the lockdown, there was this necessity to make sure that we still have food and that we still have people working in the fields. And then at least in Italy, in many European countries, these are migrants working in the field. So there was this reevaluation of these categories of migrant people. So we have actually practical positive development here. We have United Kingdom, I read, has removed the national health system charge for people working as doctor and nurse. There's a cute story from South Tyrol where a wine producer has paid a private jet to go pick up some Romanian woman that they are the people that usually work in this vineyard, and they actually pay a private jet to go pick them up because they could not find local agricultural workers during the lockdown able to do this type of job. So we have a re-evaluation also some migrant communities. So we will say we should also highlight also this more positive development, this alternative discourse, this alternative practice that happened during the pandemic to also look in a more positive way for what are the long-term consequences of the pandemic. Yes, we might have anti-migrant force be reinforced by the pandemic, more migration control, more health checks on the borders, and all these problems like minorities mistreated, discriminated. We can look at the pandemic also as, I think Daniele Conversi brought this as a stimulus to change some, based on this positive example we had, so pandemic as a stimulus to change some of the policy we put in place to start to deal with some of the problems that the pandemic, they were already there, but the pandemic has clearly highlighted. They were characterizing our society, whether it's the problem of the health system that Ranabir mentioned at the beginning, or it's the problem of raising inequalities that characterize our society. It was there before the pandemic, and inequalities are increasing, and they will increase after the pandemic. So we can look at this situation also with a positive approach, let's say.
Thank you, Andrea. We are running out of time, but I want to give the last statement to Ranabir because he had also last week at the workshop, but also in his publications, this positive approach regarding solidarity and local community help. And maybe, Ranabir, you can finish this webinar with a kind of positive perspective on this local community cooperation. Ranabir, you're muted.
Yeah, is it okay? Yeah. The positive is, how would I put it? Well, the positive is always built on certain critical, understanding. So I was intently listening to the question of borders, and there is no way that the epidemic will not create the borders. But I think what will be important is how society then negotiates these borders, borders of race, borders of localities, borders of seclusion, etc. And that is where I find that solidarity is a principle which actually wakes up or emerges as the organizing, norm of the rebuilding of society, precisely when the society faces these new kinds of borders. In India, I mean, if you see on the one hand, millions of migrant workers in utter destitution and in enormous trouble because of the sudden lockdown, 300 people just simply died on the road when they wanted to walk some 500, 600, 800 kilometers. On the other hand, you may say, if you use the phrase as a kind of militant philanthropy, which has emerged all over India. I have a friend who has now, if you are interested, I will send you the map. It is called Maps of Resistance. It is dotted with several points across the length and breadth of this huge country, where local people, migrants, trade unions, local organizations, local municipalities, they all rose up in terms of solidarity. But is solidarity enough? Or will it become naturalized and will it then be co-opted into the human history of philanthropy? The question is that philanthropy will never be critical enough towards reorganizing power. But disease, and a disease like this, whether you speak of the Spanish flu or the Boxer revolt, again, you will see that massive disease outbreaks cause reorganization of power. Now, it is in that sense malaria in the colonial history of India, the national mission for the eradication of malaria. So I think while solidarity emerges as a counter principle or a counter practice, if Foucault would have called to the phenomenon of new borders and boundary makings, the question is that can we build up a new imaginary of a public power that takes solidarity and care as a fundamental norm of life? So if you link security to life, how does power secure life of the common people? How does power help society in negotiating the new borders that emerge in saving human lives? That is the question where I think security directly links with the question of care and the reorganization of power in society.
Thank you, Ranabir. So we have really to come to an end now, and I thank all the panelists for your contributions. Thank you, Roberta Meda-Windischer, for organizing the chat, although there were not so many discussions on the chat today. And thank you also to Hannah Mitterhofer, who is always organizing the Zoom, the invitations, and the technical stuff. Next week, on Tuesday, again, on the 7th of July, we will have the next webinar on economy, minorities, and COVID-19. We will have, again, a regional approach with Schleswig-Holstein, Carinthia, and also South Tyrol, speaking about socio-economic participation of minorities. So next Tuesday at 3 o'clock in the afternoon. Thank you so much, and good evening to India. Bye-bye.
Thanks to all of you. Günther, see you at
Bye.
some point. Thank you. Thank you.
Bye-bye. Take care.
Bye.